My first question: describe a key difference in how Alzheimer's disease affects memory compared to normal age-related memory changes. The key differences between Alzheimer's disease and the usual age-related memory change is as follows. First is with normal aging. A person may sometimes forget names, events, or where he put things, but he usually remembers them later, and this does not interfere with his daily life. And with Alzheimer's disease, memory impairment is more serious. A person often forgets recent events, repeats the same questions, gets lost in familiar places, and eventually loses the ability to perform habitual actions. It is a progressive condition that significantly affects daily life. My next question explains the clinical process used to assess gender dysphoria, including key evaluation methods and criteria. Gender dysphoria is a condition in which a person experiences severe psychological discomfort due to a discrepancy between their gender identity and who they feel they are, and the gender assigned to them at birth. And the clinical process of gender dysphoria assessment includes the following steps. First is medical history collection. The doctor examines a person's life history when feelings of gender inequality began to appear and how this affects everyday life. Next is psychological assessment. Interviews and special questionnaires are used to assess the stability and severity of gender identity. My next question: explain neurocognitive disorders, including their classification, symptoms, and underlying causes. Firstly, neurocognitive disorders (NCDs) are brain disorders that affect cognitive function, for example, memory, attention, thinking, speech, perception, and behavioral control. Classification of these disorders: mild neurocognitive disorders is a moderate decrease in cognitive functions that does not significantly disrupt daily life, and severe neurocognitive disorders, dementia, is our market. My next question: explain neurocognitive disorders, including their classification, symptoms, and underlying causes. Firstly, neurocognitive disorders, NCDs shortly, are brain disorders that affect cognitive function, for example, memory, attention, thinking, speech, perception, and behavioral control. And classification neurocognitive disorders. First is neurocognitive disorders is a moderate decrease and in cognitive functions that does not significantly disrupt daily life. Next is severe neurocognitive disorders. Dementia is a marked deterioration that interferes with independent living. And main forms neurocognitive disorders: first is Alzheimer's disease, vascular dementia, and frontotemporal dementia, and Lewy disease, and traumatic and infections, and CR, for example, after traumatic brain injury, HIV. And symptoms of these disorders: memory impairment, especially recent problems with speech and orientation, and reduced decision-making ability, personality and behavioral changes, and others. Reasons these disorders: degenerative disease of the brain, and traumatic brain, and infections, and vitamin deficiencies, and alcohol addictions.